we will hear from Dr. Tejaswi Rao, who's an experienced neurologist specializing in stroke care, neurovascular interventions, and advanced neurological treatments. So she is dedicated in create awareness about early stage stroke recognition and timely intervention to save lives. So let's give it up for Dr. Tejaswi. Please take it forward, Doctor. Thank you.
Hello, sir. Before we begin, thank you so much for having me here. And let me start with the presentation. So as we all know, today the audience is going to be general and it is open. I like to keep it simple so that everybody would understand. So the topic today is stroke, know the signs. Okay, so as we all know, stroke is an emergency brain disease. It's as common as a heart attack, but unfortunately not as well known. So I would like to share this information to the public and the practitioners because even a minute can make a huge difference in the patient from walking out of the hospital to being bedridden for life. So today we'll be going through introduction, types of stroke, and mainly on the signs, how to identify. And just a brief introduction on urgency and the prevention which we can do for the stroke. So what are the types of stroke? We have two types majorly. Stroke is a vascular disease, happens because of blood vessel or blood supply changes. So most commonly it is ischemic, which is nothing but the blockage of blood supply to a particular part of the brain. It can be a blockage then and there, or it can be a blockage flowing from the legs or from the heart to the brain in the form of a clot, which can cause the severe damage of that area which has been supplied by that particular artery. So that is the image which shows the blockage, how it looks from internal. So another type is hemorrhagic. That is nothing but the bursting of vessel which can bleed into the brain tissue and hence damaging the particular area of the brain. There are other two types, which is nothing but transient. Transient means there is a blockage, but however, the body has defense mechanisms where the blockage is being pushed out. So if the symptoms are lasting within less than 1 hour or maybe recovering less than 24 hours, we call it transient attack. So although it does not last with any brain damage or any symptoms for life, but it has a very high risk of future strokes within 7 days to 21 days. So it's equally important to know, even though the symptoms resolve within 24 hours, we need to take it as seriously as we take an acute stroke. And the last type is a hemodynamic stroke. Basically, if the blood supply is actually okay, there's no blockage, but the blood flow, the blood pressure has come down, secondary to maybe a general fever or loose motions or vomitings, any fever for that matter. So the pressure, because the brain supply is against gravity. So because if the blood volume comes down, secondary to anything the patient is going through, there is a possibility that the end branches may not be giving enough blood to the brain as it is required for that particular minute and may end up with either transient or a long-lasting stroke. So just a brief idea about what types of stroke, hemorrhagic and ischemic. It is also giving us an idea about what are the other reasons associated with stroke, where we call cardioembolic as one of the major factor because the clot is traveling from the heart. So this is how the clot looks. The bottom picture is where the clot is formed then and there. And the top picture is the clot traveling from somewhere else and lodging in a particular narrow section. So this is a DSA picture of the brain. This is a normal blood supply of the brain. You can see how complicated it looks. So don't worry, you don't have to worry about all that. So even if one particular artery, one particular section undergoes blockage, so that the third image is showing the blockage causing that red colored area may be affected or may be at risk. So before we know the signs, we should know why are these signs so important and why only these signs. So this is an image. The first image you can see. So it is showing a particular section of the brain. Each and every inch of the brain is responsible for some or the other functions. So you can see the red marked part of the brain, which is actually a very tiny portion. But this tiny portion on the right side of the image, you can see that each and every inch is responsible for the movement of that particular part, starting from toes, thumbs, to chewing and swallowing. Each and every small inch of the brain is responsible for one or the other function. Also, now that you have seen that it is only one small tiny red mark, but what about the rest of the brain? So rest of the brain is also responsible for multiple functions. It may not just be limited to movement. It may not just be limited to paralysis, like the familiar opinion amongst the people that brain is only responsible for paralysis. Unfortunately, it is not. So this is very minor portion of the brain is responsible for the movement. There is also a huge other part of the brain which is responsible for many other functions. In brief, I will just give you what the right and the left brain are responsible for. Right being also responsible for emotions, intuitions, creativity, and art. So if we have a stroke in the right side, along with having a paralysis and a numbness, we may also get defects in these areas. Similarly, on the left side, it can be responsible for damage in the way a patient communicates, in the way patient thinks logically, in the way patient understands science. So it is not just about paralysis. So hence it is very important not just to know about weakness or paralysis, but also know the basic other functions or other signs which can be a part of stroke. If identified early, maybe help us in diagnosing and treating in future. So as we all know, the famous mnemonic, FAST, to identify the signs of stroke. So I would like to give you a small animated picture so that it fits in your mind so that you will never miss this sign. So first, F stands for face. So try smiling. And if your smile is crooked, like you see in this picture, so just make sure you rule out a stroke first before you think of anything else. A for arm. So try to lift your arms and see if one is drooping down. Not necessarily you will be able to identify at this stage. If you're lucky, you will be identifying at this stage because this is the earliest stage. More often than not, you wake up with not being able to move a finger. So if you're lucky, then if you identify at this stage, the better prognosis it's going to be. Third, speech. Either it can be not able to speak properly, you sound gibberish, or you may not able to produce a sound. So if you find any of these symptoms, it's time to call for an ambulance. Because before you think of any other alternative explanations by yourself, better to rule out a stroke because better be late than be sorry. The common mnemonic we know is be fast. I'm just brushing up on that. We have already discussed about this. There are other clinical clues. Like we discussed, brain is also responsible for multiple other functions. So you can try walking in a straight line or standing on one leg so that you can see how your balance stands. If you're not able to stand straight, you're tending to fall on one side, you definitely should think of a brain function abnormality before you think of weakness or generalized fatigue. Second, sudden confusion, sudden fogging of brain. If it lasts more than few minutes, it's better you think of a stroke before you can just ignore it thinking just let me have a nap. So I don't think you should. Third is giddiness. Giddiness is not always a near imbalance problem. It can be associated with a huge brain related issues. And to be very honest, more than a paralysis, giddiness associated strokes are much higher risk of death than sudden severe headaches. Sudden severe headaches are more commonly associated with hemorrhagic strokes, not as far common with a block kind of a stroke. Hence the seriousness, because the bleed in the brain is much more serious and much more debilitating when it comes to rehab. And seizures and numbness of one side of the body are also a part of stroke. Seizures at onset. If the patient with a stroke present with seizures at onset, they have a poorer prognosis as compared to others. And numbness of one side of the body is not just a radiculopathy or a spine or a nerve-related issues. It can be a brain as well. So just to give you a brief idea of why this identification of symptoms is very important so early is because every minute we lose around 2 million neurons. So you can understand the golden hour, that is 60 minutes. Even if you think of 60 minutes, you can imagine how many neurons we are losing, even in that 60 minutes. So reaching any hospital and getting the investigations and treatment done within 60 minutes is the target that I'm trying to approach. But however, let's join hands because it's not just a one-man job. It's actually a community plus workers plus staff and the doctors work to make it happen within 1 hour. So this is an image which shows that the red area is the area which is already damaged and the yellow part is actually at risk. So you can see the time difference where the stroke extends over hours. And any inch damage in the brain definitely lasts with long-lasting deficits for life. So the urgency, the benchmarks are you have to reach the thrombolysis, that treatment, the main treatment for acute stroke within 60 minutes of the onset of any of these symptoms. And if you have not been able to make it by chance, and if there is a huge block in the artery, then at least within 90 minutes, we would like to take you to the cath lab and remove it with a procedure called thrombectomy. But the other interventions is blood pressure management, which is also very important. Unless you rule out a stroke and the type of stroke, it's not that easy to manage blood pressure without knowing. And it is not a good idea to manage blood pressure without actually treating the stroke first. Because like we discussed, the fourth type of stroke, the hemodynamic one, where the blood pressure falls. So here you're going to actually aggravate that type of stroke. So post-stroke rehabilitation is mainly going to be beyond 24 hours. It's mainly going to be therapies and physiotherapy and risk factor modification and preventing a second stroke. Because as we all know that the first stroke may or may not be that debilitating, but the second stroke, the risk of second stroke after the first is very high in the first 7 days and still high in the next 3 weeks. So it's not just important to recognize on the day one or the first stroke, but it is equally important to recognize it the second time as well. So we do rehab and we manage the risk factors, basically the metabolic X syndrome, which we all are well aware of these days. So the golden hour is the golden opportunity, and knowing the signs from day one or the moment one will help us to treat you better because every minute counts. So at ONUS Robotic Hospitals, we have very equipped CT and MRI machines and also cath lab. We do interventions here. So if you're suffering from any of these symptoms like we discussed, I hope that every one of you who's attended this session today will not miss any symptom and not let stroke control you. Thank you.
Thank you, Doctor. Thank you, Dr. Tejaswi. And that was quite enlightening and good to know so many things about such a life-threatening condition like stroke. And I hope everybody has taken away a lot of points out of this. And thank you very much, Doctor. So as we come close to today's close of today's webinar, we would like to thank both our doctors for sharing their expertise and all of you to join us. We'll move on into a Q&A session. If you have any questions, you can type into the Zoom chat box, or you can even post your questions. I'll ask everyone to unmute and please ask your questions. Next, Dr. Tejaswi, how much time do we really have to act when a stroke occurs? Is it really like 60 minutes or?
No, it's not 60 minutes, sir. Can you hear me?
Yes, please go ahead.
So it's actually 4.5 hours when it is acute stroke. In terms of an ischemic stroke, only in terms of ischemic stroke, we have 4.5 hours time. So we insist on 60 minutes is because if they reach the hospital within 60 minutes, once they come, we have to assess, check for the stroke mimics, shift him to CT to rule out another etiology, and then go for the thrombolysis injection. So to make sure we have enough time for this to happen, because the last point of time where we can give that injection is 4.5 hours. So to make sure all this happens within 4.5 hours, we insist that they come to the hospital within 1 hour so that we can at least save some neurons and also give them the opportunity to get that injection in the first place. Because there's a possibility that if we don't insist, if they think of 4.5 hours and if they reach the hospital by 4 hours, it is close to impossible to give and arrange everything else in 30 minutes. So which is why the insistence is the benchmark internationally is 60 minutes. But the actual time period which we have is 4.5 hours.
I have another question, another couple of questions. Are younger people also at risk of stroke, or is it mainly an older age problem?
Previously, you're very much correct about this, sir. I am happy that you asked me this question. Yes, previously it was a very norm thing that everybody who is older, everybody who is having hypertension, diabetes, or cholesterol levels on a higher side are very high risk of stroke, and they have to be very careful. But I would rather say, unfortunately, that today, in the last few decades, we are addressing a lot of young stroke. Young strokes are very common these days. Also, most of them do not come with a warning sign and do not have any comorbidities that we can actually manage or prevent for that matter, because it's not necessary that they are not taking a proper diet or not on a particular exercise. Actually, they are. And most of the young strokes are very sudden, and they're very dramatic, with a very poor prognosis. Unfortunately, when it comes to young and old, the disability for the old versus disability for the young has a very varied, what do you say, consequences for the family and the kids. So yes, young stroke is nowadays very much common, and with a very high and different type of risk factors which are not very known and needs evaluation. With even a minor symptom, it needs a great evaluation that we should be making sure before the patient ends up with a disability, because once it happens, most of the young strokes uh, are ending up, unfortunately, these days with a lot of lifelong disability.
Great. Thank you. Can strokes be completely prevented if risk factors are controlled?
It can't be 100% prevented, I would say, because risk factor control plays a major factor that I should be giving it. Because if the risk factor is the main reason for a stroke, then yes. If that is the only reason for the patient to have a stroke, then yes, the control of that particular factor will completely cure or prevent that particular stroke in that particular human being. But not necessarily a risk factor in that particular human being is the same for everybody. First thing. And the second thing is, there might be multiple reasons why a patient had a stroke, not just the thickening of the blood, but also there might be some comorbs like the genetic hypercoagulability situation where they have a tendency to clot more, which is mostly genetic and unidentified most often. And it can be precipitated by a dehydration, which happened few days ago. It can be precipitated by a habit of smoking, which does not cause a blockage of the vessel, rather causes a narrowing of the pipe itself. So, in a person who's already smoking, for them, the risk factor of blood bleeding, the pipe being blocked, is very high compared to a normal person with the same risk factor with the same blood values. So we may not generalize this as a preventable thing, but definitely we can control it to a large extent. But more importantly, for that particular age, that particular gender, that particular human being, it's very important to identify their risk factors, because it also involves their family history. So there's a lot more than just the hypertension and diabetes management for prevention of stroke. But if you can actually come up with the whole idea of what that person is risk at, then maybe yes.
Okay. Thank you. Thank you very much for all that valuable information, Doctor. As we come close to today's webinar,
I have a question.
yes,
Madam,
doctor.
I have a question. If someone at risk, like genetical risk for stroke, are there any specific tests they need to get it done prior or as a preventive measure?
So when it comes to genetic causes of stroke, there is like thousands of causes within genetics also which can cause strokes.
Yeah.
So if you are thinking about hypercoagulability, that is the tendency to get thickened, which has higher chances of getting stroke anyways. In that way, yes, we can do genetic test, thrombophilia profiles. But if we have a family history of stroke, there are varied genes, and we don't have a specific gene for a particular family and particular race when it comes to India, because India is a varied genetics when it comes to multilingual, and too many genetics within India. We've not been identified a particular gene for a particular area so far. So it is not that easy to identify the gene or send for a genetic test, even if we are suspecting, unless they have other, what do you say, other clues where we can point that this could be the possible way of genetic etiology. So if you are thinking of hypercoagulability, there are a huge list of tests which we can do. But if there is any other genetic, like Zika, all these things comes under cryptogenic stroke, where we don't know the etiology. So we can go for a whole genome sequencing, but I will not be assuring you that we will find the stroke risk factor, but rather we may find a list of multiple gene defects, which will rather scare the patient in multiple organ associated risk rather than just coming up with a possible stroke related risk if we send for genetic test. So genetics general, no, we don't have. But if we come with a clue that the other organ in the body is also having a particular type of a vascular problem, then yes, we can do other testing to maybe know our risk and maybe start a prevention even before it happens. Yes, everybody should get it regularly checked and maintain it in control with basic lifestyle modifications. But unless if it is beyond that, only if it is beyond that, you should start statins or treat that if needed, but not necessarily treating a blood cholesterol level will give you a risk free of stroke for life, because the blood level of cholesterol is not giving us the cholesterol that is already deposited in the artery. It's the CT calcium scoring which gives us that. So we can't be sure that the blood level being normal is giving us at least that check from the lipid side that we are free from stroke.
Okay.
So, Dr.
Thank you.
Tejaswi.
Thank you for clarification.
Yeah, thanks, Doctor. So,
Yeah.
Dr. Tejaswi, we have a question from Miss Sandhya. She asks, what is the first aid that has to be done as soon as we undergo stroke in between we reach the hospital, while we reach the hospital?
Yeah, unlike seizures, we don't have a first aid for stroke, because stroke depends on where the stroke is and which area of the brain is involved. Only when it comes to a brainstem stroke, brainstem means the one where the breathing, the speaking, and the main control of the whole body. If that is the stroke which the patient is going through, we will be able to at least prevent aspiration, which can further lead to death, by keeping the patient on a lateral position. No, keep the patient aside. I mean, shift him to one side and then hold him there till they reach the hospital, so that whatever comes out of their mouth, whether it is frothing, not able to swallow their own sputum, or vomiting, so that they should not aspirate and maybe have an unfortunate ending during the travel, while we could save them. But other than that, if you're having a cortex, that means the upper part of the brain related stroke where the paralysis is there, or we have a numbness, um, or we have a face drooping or something like that, there is no first aid per se. Also, there is no need for the first aid, because the patient is not at risk of death for when it comes to those areas. Although there is a huge risk of disability, the morbidity is very high, but there is no risk of death in the within 60 minutes is what we are talking about. So I don't think there is any first aid which a non-medico can be able to do with no instruments at home. It's only about the brainstem stroke.
Thank you, Doctor. Any more questions, you can always email us and we'll get back to you with the answers. Coming to the end of today's webinar, thank you, Dr. Tejaswi and Dr. Raghuteja, for sharing your expertise. And thank you, all of you, for joining us today. Your feedback is very important to us. So kindly take a minute to fill out the post-webinar survey, which will pop up after the session. You can, alternatively, you can also fill it up. It will be sent to your email as well. You can fill up there. It will help us improve and also plan future health talks on topics that matter most to you. So stay connected, stay healthy, and we look forward to seeing you in our upcoming webinars. Have a great evening. Thank you. Bye-bye.